What if you could sit down once a week with a colleague who's a flat-out warrior? This colleague wasn't a stud in dental school. He struggled. He returned to practice in his hometown, an area once labeled by USA Today as the second worst place to live economically in the United States. And this very same colleague went on to establish an historically successful general practice known worldwide. What if you knew someone that wanted to take you by the hand and show you everything you need to know, from treatment planning to leadership, to maximizing your journey in dentistry, or just life? You ready to be inspired? Welcome to the Lionhearted.
Hi everyone, Dr. Steve Rasner here, and welcome back. Welcome back to the Lionhearted Dentist. I'm not on the road. I'm not in Portland, Alaska, Africa, or anywhere else. I'm right back here in New Jersey, and I work today, and as you know, I believe I do my best podcast when I work. And so I'm going to give you the title of tonight's podcast in case you want to just tune out and skip it. How's that for being real? But I'll come back to it in a second. But the name of it is How to Fix Being Too Busy. How to Fix Being Too Busy. And I have some really provocative thoughts about that title. But before I get to it, listen, if there's a subject you want me to talk about, enough of you, more than ever, certainly write to me these days. And so do so. One of you recently wrote that you would like me to talk more about clinical. And I can do that as long as I don't have to use demos and models and get up close with, like I couldn't teach suturing, or I couldn't teach, to be quite honest with you. I probably could do that stuff, but I'd have to have more of you that want to know that. That is what my live courses are about. It is what I'm going on the road to Arizona this weekend for. But lately, I don't know, I really thought I was tuned in to what you guys wanted to hear, but it doesn't feel that way from my downloads. So I'm sulking here. I still have great followers in, where was I just looking? In certainly the United States. Thank you guys. And United Kingdom, Canada, Germany, Singapore, and Guyana are liking the Lionhearted lately. Listen, I appreciate every one of you. The only feedback I get, other than the mailings you send to me, is when I look and see what countries and how many you downloaded. That's really the truth. So, I was skyrocketing up to about 3 weeks ago, and it inspired me. And I really thought I was on to something with the people in the hallways and the common threads of a Lionheart dentist. And I know many of you are that. Shameless plug again for two things. I just had my extraction live course this past weekend. This is, if you're seeing me, I'm telling you the truth. I would never, ever exaggerate so that one of you would sign up for my courses. But the next courses are in March and April of 2023. I have one in 5 weeks, but it's sold out. I already have 5 people signed up for the extraction course, which is treacherous to give. It's really hard. It's harder than the implant course, to be honest with you, for multitude of reasons. But the momentum that those courses have gained is phenomenal. Much more momentum than my podcast lately. And again, I continue to hear from so many of you. I'm absolutely positive that when we do the live How to Put It All Together course for the Lionheart followers, that it's going to be a pretty smashing success, because I really have gotten a lot of feedback from that. And what you could expect in that course are me really breaking down every single aspect in great detail that I've given you here over the last couple years, and breakout sessions that your front desk people need to know. And you better believe that I will have my team ready to deliver. What is literally the words we use to get the significant other to come to that visit, which results in case acceptance? What are the words I use for literally every single, what is the strictest guideline I could give you? And what makes me say what? Because I don't always obviously say the same thing. How do we get paid up front? That must be a big one to most of you. How do we control overhead? Well, how do I get my team? And they'll be there. And they are no fear of communication if they're in this course. They have to say what really is, the good and the bad. Mostly good, I think. I hope. So let me get into this because it's important to me. So that's the live plug. I haven't given a date yet. As you've heard me say, I'm thinking of keeping it in a major city like Philadelphia, where I live, but I practice in Jersey. So as many of you who could fly, it's got to be 2 days. Why would you want to come from California for 1 day? Or even if my European colleagues or Brazilian or whatever wanted to come up, I'd love it. I will make it worth your while. You'll be treated. We'll definitely have like a cocktail party after the first night. The Lionhearted way of working hard and playing hard. We'll have a good time. So, how to fix being too busy? Well, let me first say to you something really, it should be obvious, but it's never, to me, not worth hearing once again. Why am I so busy? And I know I came on this podcast either last time or the time before and told you I have reached a saturation point of busyness that I could split myself in two and come close to, I think, doubling my production. I mean it. So how's that possible? I wrote down 5 things if I just had to put it together. And the first is making trust and confidence the MO of your practice, the culture of your practice, that people come to you because they trust you. You're not going to rip them off. Look, many of you have foreign cars, BMWs, Mercedes, whatever you have that are listening tonight. Is it just me, or when something's wrong, don't you get a little bit intrepid about taking it to the dealer? Does it ever cross your mind to take it to the smaller guy that's got a garage that is trained in fixing or tuning up or whatever you needed foreign cars because you feel you get waxed? It's a trust thing. It absolutely is. And trust is everything, man. You've heard me go on record. I pay absolutely top dollar when I go away to stay, whether it be the Four Seasons, which I like a little bit more than the Ritz-Carlton, or whether it's a restaurant that I'll frequent, and I never really worry about the cost, because in those places, I actually think I'm guaranteed to get quality service in the arena that I'm looking in, and that's to get away for a weekend and R&R or whatever. It's worth it to me. So you start by really saying, are you that organization right now? Do people come to you because you are the most inexpensive? They come to you because you're convenient. You know, you're open on Saturdays and Fridays and nights once or twice a week. And part of me, I don't want to confuse you. In the beginning of your career, those first couple years, 2 or 3, You have to do, hours wise, whatever you have to do to let that community know you exist and that you are trustworthy and worth going to. And confidence comes from your training. Like, people can trust you, but if they don't have confidence in your skill, if you've not put in, that's why you always hear me talk about the lifetime investment of CE, because when you do that, it's very unlikely that you don't understand certain basics that'll prevent you from doing crowns that keep coming off again and again and again. I mean, I just had a patient go and have 3 implants done by who I thought was a reputable organization, the oral surgeons. And this particular gentleman that had 3 implants done, that was the furthest thing that he should have even thought about doing. They completely, yes, he was missing posterior teeth. The existing dentition was completely worn, tremendous loss of vertical dimension of occlusion. There's no way that's where that case should have started. And eventually, that's going to catch up. I don't know whether it's an aberrant incident in this particular organization. I don't know. I don't even want to know. I don't think that's where you should ever go. So, trust and confidence is how I got busy. And that's not just your work, by the way. It's being on time. It's having your bill not keep changing. It's being very clear in the very beginning, and in my case, day one, about what they can expect their out-of-pocket expenses to be. You know, patients say to me, I know they say it to you, can you give me an estimate? No, I'm not going to give you an estimate. I'm going to tell you exactly what you can expect to pay. And when you say that, you better stick to it. Now, it's easy for me to say that because one of the benefits of being out of network is that you're able to figure out the patient's out of pocket. But there's other parts that have made me busy, and it'll make you busy. That's why even when we do the 2023 live Lionhearted, there's so much to talk about, because at the other end of being clinically expertise at what you're doing, it's having a culture where you're gratuitous. And I talk about this with you, where I don't nickel and dime them for every service I may have missed. You've missed services. And the worst thing, and I've said it, I'm not going to make a big thing tonight about it because I want to go in different directions. The worst thing you could ever do is have a philosophy like a Lionheart where you get paid up front, misdiagnose something, and add a $150 fee because you found another cavity. I'm sorry, do a better exam to begin with. And then don't charge them the extra. That is so far from where I want you to live. Being community. I'm telling you, I have faltered in since COVID. It's the truth. But up to COVID, including that year, we gave back to our community through tangible, palpable ways. So many years that it'd be impossible for people that lived in that community not to know that we did that. And starting from the roller skating parties we had for the children that came back when I took children and their parents, and the cost of admission. And I can give you all these programs because I think they're still effective. The cost of admission for a 90-minute skate with a slice of pizza and a beverage would be Toys for Tots or Coats for Kids, whatever we wanted it to be. It's really how it started for us. And then it led to everything. It led to dinners for, like, Thanksgiving dinners or Christmas dinners where my whole staff would participate. And you want me to be honest, we did so much of it that the community doesn't even know about half of it, because sometimes it wasn't a thing that I wanted anybody to know. Or maybe it was a Thanksgiving dinner for, I don't know, single mothers with a history of drug abuse and they had broken lives and children split up, and we just did the right thing. More than our share. And I've told you over the time I did a tremendous amount of things. I'm just telling you, with the ARC Association of Cumberland County, New Jersey, that's the mentally challenged. We had proms after proms and senior citizen appreciation dinners. I just couldn't. I could go church functions. We rented a park several years ago. I mean, a state park. I guess you were allowed to do that back then, and had zoo animals. I'll never forget seeing them come off the truck, and that was a mentally challenged event where we gave them camp for one day. And all these, by the way, ideas were born from monthly meetings that we never faltered. We had them all the time. So that's when I tell you being community is one of the reasons we got busy. It's not just being excellent at what you do, being honorable. The cost of doing business, I said this last week. Sometimes if there is a hesitant, an ounce of doubt whether it's me or the patient, I always defer to the patient and will do something over. I will. And I think it's a good philosophy to adopt. It would be really hard for patients, I mean it, in our community, and I hope in many of yours, to say messy things about your practice, that you're not honorable, or this or that. And how we look, and how Walt Disney clean has always been important to us. So that's how I got busy, amongst a lot of other things. I'll say this before I go on to how to fix being too busy. When I walk through my reception room on any day, it feels like if I stayed in and didn't just walk through, don't be mad at me for this. It's a culture that we worked hard to establish, endlessly worked hard. I almost feel like they would start applauding. I really think the overwhelming majority of a very big patient population are extremely pleased that they chose us. And you have to remember, I'm telling you this, that I'm out of network, that we're certainly not the dollar store, and the patients know that. And so, and not everybody gets all on whatever and full mouth restorations. When we can quadrant dentistry, when we can prioritize and tell the patient that hopefully over the next 10 years, you'll have the mouth that you always wanted. It'll be at a rate that works for you if I can treat you that way. And I can't always do that. And you guys understand that. But how do you fix being too busy? I know exactly how you fix it. Number one, you slow down and you add time to your services. Now, some of you were saying, well, because let me tell you, being busy is probably not profitable. I mean it. Being frenetic, reckless, running around, treating more patients, always being behind on time, always. And I'm going to be honest with you, I'm going to look you dead in the camera tonight or in your ear. I feel my practice in a couple last months out of nowhere, somehow, and you've heard the flavor of this in my last couple podcasts, has slipped a little bit into that. I do. And I've been in practice for 42 years. And it's one of those 4 o'clock in the morning things that bug me. And I'm all over them. This is my legacy. I'm not practicing forever, man. And while I'm here, you're not going to screw it up for me. And I'm talking about my team. It'd be different if I was the boss telling them, we need more production. We need more revenue. That's not what they're hearing, ever. There's no reason. And I'm making changes. I feel I'm teaching all the time. You want one I made this week? So you've heard me say I do 3-hour surgeries. Okay? For me to take out a dentition, level the bone, place 4 or 5 implants, etc., etc. That's not, I'm sorry, that's what it takes me. I'm not in a race. And I realize it always seems that I never have enough time. And this is going to be incredibly not profound to many of you. But the point is I don't like the feeling I've had in the last 3 to 4 months. So I've searched for reasons. I could be on easy street. I don't have to search for reasons at this point. But that's not me. And it's not many of you. When things are wrong, you should be searching. When it doesn't feel right. And the feel right has been, I've been behind too much. Or I feel like I'm rushed. And I'm the one that tells you to give more time to all your services. And I've done that. But what I realized is that on these long surgeries, which are a big part of my days, we could start at half an hour behind. That patient needs to come in a half an hour before the time I have scheduled so that they are, they don't walk in my office, sit down and say, let's go. Hell, they're sedated. They're put on pulse oximeters. They're monitored. We're pre-op vital signs. They're anesthetized, often bilaterally. Does every block take the first time you give it? By the time I roll in and they're ready, 35 minutes are off. So I addressed that. I had to address my clinic team. I had to address my front desk team because it's a 2-point of coordination to make that happen. So slowing down, actually, see, when you're too busy and you're frenetic, you make mistakes. That's the problem. Open contacts, putting a crown in that, I don't know, had barely a contact, but you were so behind that day, the last thing you wanted to do was put the temporary back in. You know what I'm talking about. Or whatever it is that you're doing that you could be doing better. And you're not going to be able to do that unless you charge appropriately. And you can't charge appropriately unless you've earned it. And I know many, many of you have. Many of you have earned it and you're scared to do it. And shame on you. Yeah, I mean it. You're taking Dawson and the Spear Institute and COIS and all the places I would recommend. And you go back to your hometown in some small part of your state where nobody else charges a lot of money. There is a market, my friend, for excellence. And actually, you'll be doing the patients a favor. I know maybe you think it's BS. It's not about anything but if your fees are appropriate because you've earned them. And I'm not telling you just raise your fees because patients will pay it. Because if you're mediocre, you'll get away with that for a year or 2 or 3. And then you won't. But if you earned it, I'll give you my guide. I mean, I'm probably off because I think I've slipped a little in the last couple months. I'm going to come out. I'm coming out of it right now. I feel it. And the slipping is about me coaching my team. That's what I mean. I mean, sometimes you're just not in the mood, right? To teach. It's hard to stop what you're doing, call a meeting together, whether it's 3 members of your team or your entire team, but it's I believe in most offices, even most Lionheart. When I say that, it's a compliment. In a place that believes in a lifetime CE, a place maybe that does rubber dam dentistry, a place that does diligence to medical thorough histories, not a chop shop. Those people don't listen to the Lionhearted. That's fine. I'm talking in many quality offices, you haven't taken that last paid. You're definitely still taking insurance. And this is stuff I'm going to scare out of you at a live course. If I can't change you over over this podcast, I'll change you in person. I will. You won't be able to get away from me. But you need to charge appropriately, because when you do, you can slow down. When I say slow down, I'm not talking about taking tea breaks. I'm talking about giving more time to your procedures. And then I'm going to also say to you that you have to have a staff that's accountable. You heard my last podcast, The People in the Hallways. It didn't end there. My people are really good. My staff, my team. But even them, some of them not teaching other colleges, teach hygiene and dental assisting and things like that, besides working for me. I don't know how you can call me in a room and miss a very obvious lesion that you should be able to see and you should point out to me. I know when you come in and giving me a slip, I've talked to you in the before that I have hygiene cliff notes cheat sheets. Each hygienist drops off in the room I'm in a cheat sheet. I'll send it to you. I have it on my computer top. And it saves me time. It focuses me on the patient in their chair that I may have completely forgot about. And it tells me the last work they had done, whether they took x-rays today, are there any chief complaints, or maybe compliments on the work we did. Something to focus me right in. So when you tell me there's a broken restoration, I don't want to have to ask when was that placed? Never wasn't done by you, doc. Whether it's a crown, they're having recurrent decay in. That their gums don't look good. Well, when were they last scaled and root planed? Are they a 4-month recall? This is information that I expect you to bring to me and not make me ask for. There's a lesion. There's a tissue tag intraorally. Well, we photograph everything because my memory is not good enough. So show me the last picture and show me it today. Do you hear me, guys? There are ways that I delegate enough, and some of you do too, that I shouldn't have to reinvent the wheel every 3 months, and it feels like I do. And that's not being accountable. And when I say that, when I have these little talks with my team, and I do, I'll bring that hygienist out and say, listen, and I don't yell, because that's not appropriate. I'll say, we've been over this, right? If I miss that lesion, I have this limited span to come in with you. I need you to be a professional, to not just talk about nonsense for the 45 minutes, an hour. They get an hour in my office. I give them more time than they need most of the time. I don't want that to just be a social hour. I expect them to be professional, trust, and confidence. Confidence, God forbid that they tell another dentist that my hygienist superficially cleaned them and didn't do the exams at a level and tip me off. I need to be surrounded, and you need to be surrounded by a team of professionals that are committed to the same level of excellence that you are. This isn't a party. It's a workplace. And we can have fun. It's always my thing. You can joke and laugh all day. I don't care, you want to do a Starbucks run in the middle of the afternoon, but your work better be done. It better be done really well. And not 36 out of the 52 weeks a year. Why else would you want it any other way? Why would you want it to be anything but your best effort every day you're here? And one more thing before I close. Don't call off on Mondays unless you're in a hospital. Now, if that doesn't break my fan base, nothing will. I'm sorry, guys. I have very little tolerance for people that call off on Mondays. You better be sick. Or you just don't fit in my culture. Or a lion-hearted culture. You can take off all you want. My team can take off whenever they want, as long as they have checked and for appropriate coverage. So if it's front desk, hygiene, obviously if you have 4 team members, this is way more hard. But that's how it's been in my office for 20 years. Hygienist takes off, dental assistant, front desk team member. They've already checked for coverage. Yeah, they can take off as much as they want. Now, there's limited numbers of days they each have for pay. I'm not against that. I'm just against calling out. And when it's a Monday, I'm suspicious. I'm sorry. Put it in your hate mail list. I hope not. Hey, I'm just trying to be real with you guys. And I know you can relate to just about everything I'm talking about. Let's keep it going, guys. What do we have here? Wow, we have like 8-10 weeks left. And then we're on to January 23. I hope it's helping some of you. I appreciate you. See you next week on The Lionhearted.